I mean, it's not fair. But what you really have to do is actually operate within the laws of cause and effect. And so this is the important part, right? The take home on this is you're going to take the cup of your hand and put it underneath here. And you're going to, now notice now, where's my arm lining up? It actually lines up where remember the thing I talked about, Chuang Tzu, in a poem that said the alignment between intention, action, and consequence? You know, so I intend to create a vector that is going to go down and create this axial extension. It's what?
Axial extension.
Thank you. And I've now created an action that's probably going to be consistent with it, right? So that the outcome, which is the release of the tender point, should be pretty assured, right? So my elbow's locked in my belly. I'm dropping myself forward. I'm not doing anything with my bottom hand but listening. And I'm kind of pushing myself up. And I'm coming in and out. I'm going to go a little bit more, capture more of her head with my thenar eminence. Come under. And that feels pretty good. How's my forearm lining up? Yeah. Does it look like I'm expending a lot of energy? No, it's all body weight. Immediately. Just to clarify, I feel the point melt. Yes? That means that the treatment is beginning. Right? It's not an end point. It just means that this is all the work to prepare the body to begin treating. It's really important. And where we are is feeling just at the tips of our finger, at the level of that, and we can feel the energy working. It feels like I need to add a little bit more compression. That feels good, doesn't it?
Mm-hmm. It feels good in my sternum.
Yeah. And now the point at which had gone in is now starting to refill and work. And I start to feel a sense of the beginnings of breath and flow. I'm going to wait till it completes something, till I get a good breath. Which is there. We're way under the 90 seconds that Dr. Jones talks about, which you should sort of think of if you've been on a point longer or approximating 90 seconds, maybe you are lingering. Maybe the point hasn't released and you need to do... I mean, there are only several possibilities. One is that you're really enjoying yourself and you're just hanging out. At some point they start treating you. You know, and that's cool. The second is that you really haven't gotten the adequate release. It hasn't breathed because the system, the segment doesn't have the resources it needs to treat. And that's really important because that means you need to go somewhere else to produce the resources to allow this to release. Now, how's that feel? Wow, it's soft.
That's fine.
Did anybody feel this before when I was holding it? No. Oh, it's really soft. It's great. So we created a change in the nervous system, and immediately there's a neurogenic change in the tissues. I mean, the disappearance of the tender point and the softening of the energy is all neurogenic, right? It's all based upon nothing we're doing here. Think about it in terms of the big circuit. We change the data wherever we're doing this, right? We're creating a vector. We know we need to do that. The data are going into the spinal cord, into the brain, shifting the body map, shifting the brain's control of the body, and it's coming back out, giving different directions to the nerves. And directions that aren't associated with distress and anxiety and terror, right? You know, and it manifests it now. There's nothing I could do locally that would have produced these changes. These are only the result of a huge shift in the reflex loop between body and brain. It's kind of cool.
Very cool.
Now, let's take this away. Take it, please. It looks good with your vest.
Thank you.
Slide up to me, please. There. Now, C2 had pure rotation with axial extension. Right? C3, so as we start at C3, we're starting to drop back, C4, we drop back a little bit more. C5, we extend a little bit more. C6, even more. C7, even more. Okay? That's working our way down. At C2, we have just rotation. So the mantra here is rotate towards, I'm at C3. There's this one C3 on the left. So we drop back to where we start to feel it float a bit, like there. You're good. I'm not going to drop you.
You're feeling the point float?
Yeah, you actually feel the segment on which the point's attached kind of soften. Yeah, and you'll feel it. It like just kind of melts in your hand a little bit because we just did one element of it, right? So the next component is going to be rotation toward. Now, since I'm at C3 very high up, it's going to be almost all rotation. So I'm dropping back. I'm rotating toward. That's good. Now, if I held the head and neck as a unit and I side bend away from the point, that's the side bending I'm talking about. And how does that feel when I do that?
No, feels fine.
It's almost gone, right?
Yeah.
A little remote thing there, but hardly worth mentioning. So that's C3. Versus, if we were looking at C7, you'd something way down here somewhere. Go digging. Right side. Thank you. So if we had C7, we've got to go all the way down here. And now it's got a much bigger, now when we bring her in this much extension, there's almost no rotation. The spinal mechanics do not permit much rotation, but they really want a really big-ass side bending to create a vector that's going to get in there.
Side bend away.
Side bend away, exactly. How's that feel?
Just a little bit tender.
Hmm?
A little bit
A
tender.
little bit tender. Maybe from here I can give you a little rotation. How's that now?
A little better.
Yeah. See what I'm doing? I'm sort of tweaking little bits and pieces and add a little bit. How's that?
Oh, there's a big stretch.
Yeah, it's a big stretch.
Oh, there we go.
Ooh. All them segments is talking to each other. It's kind of like when the triangles line up when you do the CVJ. It's like all of a sudden you feel all this crosstalk starting to happen. And that's localized breath. Now, is she done treating? No. Does she need me to hang around anymore? No. I'm out of here.
You started it. You opened the door.
Yeah. Well, and I waited long enough to be sure that she can go through the door. Right? Yeah.
I just heard you say to someone that the person's chin shouldn't go up, something around supporting the head, but it looked like when you went down for 7 that...
Well, she has a lot of restriction back here. So I can't, I do the best I can with, but hypothetically, come a little bit further off the table. Jeannie carries a lot of tension in her upper back and neck. But hypothetically, when we bring her back, the whole system would, see, now we're getting her to drop back a little bit more as a spinal unit. If she's here, like I have a lot of patients that, not a lot, I have several patients who will not relax their neck, no matter what I do, how many years I've worked with them. I could hold them like this, hold your head right where it is, don't move. And I'm trying to work, and I realize it's concrete. I'm not getting in. And I take my hands away, and they just, they're like that. I mean, and there are 2 people who come to my practice, and they know they do it. They feel bad about it. It's the best they can do. And literally, I'm working away, and just like, this is really hard. I'm not getting anything. And I take my hand away, and their head just kind of goes like that. And we do the best we can. Counterstrain is actually really good for that, since at least we can position them. Hypothetically, her whole spine would just go straight back like that, right? Rather than that, which is really happening at C1, C2. Yeah. You all see the difference? You want the entire spine to move as a unit, head and neck.
Do you want a glass of water?
Yeah, please, actually. I think that's it. So really what I want you to do, and there's no harm, like if you have them off the table, having them rest on your chest and belly. And then they're partly supported with your heart, and then you've got your hands free to where you can just kind of work your way up the, see what I'm doing? I'm just kind of working my way up the mass where I can feel, and if they're relaxed, I can feel like, ooh, there's a spot, there's a spot, there's a spot, there's a spot, right? And then I can arrange my map to, this is what I'm going to do. Thank you.
Sound effects, cheese.
That's right.
Why are you all laughing?
No, say your comment.
I said it's easy for you to say about resting someone's head on your chest.
Or not.
Oh, no.
That's true.
Let's say
A bigger problem.
It's true. What you also could do with it is put a pillow on your
Underneath,
knees
yeah.
and drop. If you've got a table that raises and lowers, drop your table.
Wait, wasn't that part of the Cape Cod girls' technique?
No,
No.
That's the pie wedge,
Not
right?
just-
That's a different part of the body.
Southern points.
Yeah. I mean, after what's gone through, under the bridge, I don't think you should quibble about
I
it.
know. Yeah, whatever. Our reputation will just grow and grow.
You know, the deal is too, is notice if I lock my elbows into my torso and rest her on the crest between my thenar and hyperthenar eminences, then it frees up my fingers to move all I want to as well. See that? My fingers are totally free and I can move them around. Happy fingers, right? So remember the mantra, okay? C2 is the one that has axial extension, compression, axial extension. That's the C2 posterior. And we always rotate toward, and then we're compressing up. And you should feel that nice sort of buckling up, sort of like the card being squeezed at the ends, go like that. At any point, if I feel like I just need a little bit of extra oomph, I can always add a little bit of axial extension. Right, here I am. Where am I? I was just at C5. There's a little knob there at C5, right? Narrowly spot.
Yeah,
And I drop back to it. I rotate toward it. And it's kind of equal rotation side bending now. And I side bend away as a unit. And it's like, oh, it's tight in there. So I've got my hand in the same kind of position here, and watch what I'm doing with my belly. I'm just dropping forward, adding just a little soupçon of axial extension, which is going to work really strongly on that posterior column, where and immediately it kind of feels good, doesn't it? Kind of. So you can always add that stuff. Slide back on the table. So this is, other than C2, which is obvious because it's right kind of under the, thank you, because it's under the, what happened to our little green thing? You're holding on to it? It's so Christmassy. I always think of South Park. Hey boys, girls, looking awful Christmassy around here. Oh God. Mr. Hanky, is that it? Mr. Yeah, yes. I never take you for a South Park person.
Yeah, I know. I have a son who's a South